everyone, welcome back to Mom Eats World. I'm Anjali Yusuf, founder of Radiant Heart Center, Virginia. This is what really happens on the show. Keep going.
And I'm Khyati Salter, owner of Vyana Infant Massage. And today we have Tetsuhiro Ueno, who is my acupuncturist for the last 15 years.
What?
Yeah, super long
gosh.
time. So he has been there for me and my husband through all the stages and ages of life. And so we really appreciate all that he's done for our family. That's what I wanted to bring into the show and talk about acupuncture and how it can benefit new moms and pregnant women everywhere. And also the whole family could actually support. So
Wow.
thank you for being here.
No, thank you for having me.
Yes, we're so happy to have you.
Thank you.
So, can you explain what work you do?
Yes, I'm a licensed acupuncturist, and I'm doing acupuncture and Chinese herbal medicine. And I'm the owner of the Caring Acupuncture, which is located in Alexandria, Virginia. And so as a clinic, we offer acupuncture, Chinese herbal medicine, massage, and also vaginal steam. Do you know that?
Yes.
Like a breeze, it's called breeze steam.
Yes.
It's good for women. A woman.
We're going to do an episode on vaginal steaming.
Okay.
It's really important.
That's
Yes.
good. And so before opening my own clinic, I used to work in integrated clinic in Arlington, Virginia for 10 years. And 2 years ago, I opened my own practice in Alexandria.
Cool.
Yes.
And since some of our listeners may not know what acupuncture is, can you tell our listeners what acupuncture is?
Yeah, so acupuncture is like one of the Chinese medicine. We use a small tiny needle, and we stimulate the point of the body. It's called like acupoint, and each acupuncture point has some therapeutic function. So we, based on diagnosis, we pick up some acupuncture point to stimulate to achieve the goal. So for example, if you have some like a digestive problem, we have some point to improve your digestion, so we use those kind of point. But overall, acupuncture can improve your like energy and blood flow, imbalance between like yin and yang. So that's the whole function. But in order to choose particular point, we need to spend time to make a proper diagnosis.
And what led you to his work? I know that your background is...
Yeah, I'm originally from Japan. I used to work for a Japanese governmental agency, which is doing like international development, so like helping like third world countries and like Africa. So because I wanted to use my energy to help people who really need help. And so I really like the purpose of the organization, and I really enjoy it. But since it's like a big like a governmental organization, so sometimes I didn't feel like I'm helping these people. Instead, I focus on more how to say like paperwork, like budgeting, bureaucracy, and so that accumulates some like frustration. And also it's so busy, so. Because of the stress, and my health was not so good, maybe because of that. So I started thinking I can do maybe something different. And so when I was assigned to like Washington DC office like in 1999, my health was not so good. So my friend recommended to try acupuncture. So I went to one of the acupuncture clinic in Annandale, and I met some Korean doctor. And so I got the treatment. So I was impressed with the idea of the acupuncture, and so that's the starting point, to think about acupuncture.
Wow.
It's so similar, right?
To so many
us and the folks we talked to, just different backgrounds that we started with. Even in nonprofits, like we want to make an impact, we want to do good in the world. But sometimes you get lost in the bureaucracy and politics, and then that leads us to helping people in a different way.
Right.
So I think that's great that you do that.
Yeah. So it's totally different field, but I can get the reward from just helping the people like directly. So it's very rewarding job. So.
It's rewarding. That's great.
Yeah. So you just shared acupuncture as far as maybe digestive issues, but how can acupuncture support? I know women can be supported pre-conception when they're trying to conceive, and then also in pregnancy. Can you talk a little bit about that?
Yeah. So acupuncture can help like many way because sometimes people misunderstand acupuncture just for the pain, but acupuncture can, as I said, digestion is one of the issue. like woman's issue,
Yeah.
emotional issue like depression, anxiety, and so acupuncture can help like so many ways. And for women, as you said, like before conception, and of course acupuncture can increase the chance to conceive the baby. I think some people, and do you know like IUI and IVF, some
Yes.
artificial, so they combine those kind of artificial method to try to conceive, but many research said acupuncture can increase the success rate to like more than without acupuncture.
Wow.
So people combine IUI, IVF with acupuncture. So that's one thing. But also, even some people, they don't want to try those kind of artificial treatment.
Yeah.
So they just want to try to improve their own body.
Yeah.
So acupuncture can help to optimize your body's condition, and so that will increase the chance to conceive. So that's the maybe before the conception, and acupuncture can help. After being pregnant, and of course, let's say many people complain like morning sickness. Of course, acupuncture can help that. And sometimes people asking me if acupuncture is safe, and yes, acupuncture is safe during the pregnancy. And I just need to mention. And so yes, morning sickness is one of them. And sometimes people feel like depressed and anxious actually being pregnant, and acupuncture can help with that. And more complication, let's say if you have the baby's position is opposite, like a breech presentation, and acupuncture may help, and so that's another thing. But also another thing, gestational diabetes, the diabetes during the pregnancy, preeclampsia, that's like high blood pressure during the pregnancy, and acupuncture may help too. So there are different things, even like a lower back pain, acupuncture can help during the pregnancy. Because during the pregnancy you can't take medication, so that's why people are seeking more like a holistic natural treatment, and acupuncture can be a part of them. And the later stage, when you are close to the due date, and let's say you pass the due date, but you prefer natural delivery instead of like inducing medication or induced by medication or C-section, and acupuncture can be used for, we say, promote your delivery too. So yeah,
it actually can help induce labor, right?
yes. So I don't want to say inducing, but because it doesn't happen right away, but it will help to promote inducing the labor. Yes.
Wow.
Yes.
That's fascinating.
Right.
And how, is it that you do acupuncture one time, or do you go certain amounts of times? It depends, obviously, probably on the severity.
Yes.
If you have a little gestational diabetes versus a lot of, for example.
Correct. That's correct. So, but yes, it depends on each condition. But in general, your body needs more help in the beginning. So usually I recommend like more session, like at least like once a week to start. And after your body is improving, we're gonna just step away. So that means we can space out the session like little by little, and so that way your body can maintain the good condition like with less help. So start from once a week, once in 10 days, once in 2 weeks, gradually space out. In general, I say like 8 to 12 sessions in order to achieve like some goal. Of course, some people need less, some people need more, but that's the general number.
Good.
And I still go monthly, so it's more like an upkeep maintenance, which I feel like in this country we don't put a lot of priority on maintaining health and wellness. It's more after we get sick, and we don't want to spend the time and the money, and then we have issues later, and then we want to spend all the time and money to fix it. But I think if we spent more time and energy on just staying healthy, and that's what you do. So even after you have a baby, so I might go to acupuncture for better sleep. There's a point at the center of our forehead that we'll put a needle and I'll fall asleep like the best sleep ever. And so that actually brings us to our next question. What are some misconceptions about acupuncture?
So I think one of the misconceptions is sometimes people think acupuncture is very painful. But as you know, like needles are very fine, tiny. Actually, even you don't feel almost like nothing. And as Khyati said, it's very relaxing. So acupuncture is not painful, and it's very relaxing treatment. So that's one thing. another thing I already mentioned, acupuncture is not just for the pain. Acupuncture can cover all of the health condition, and so yes, it's not just lower back pain, knee pain, headache, and acupuncture can cure so many things. So yeah.
And so, like you were saying, it kind of helps stimulate the certain areas, the acupoints, where, you know, depending on what someone's condition is.
Right.
And then it's just changing and making the energy flow better in the body.
Yeah, that's correct. So we believe like each organs, your kidney, your liver, and these organs have some like different function than Western medicine. So when we do the diagnose, I ask many questions, checking your pulse and see your tongue, and find out what kind of imbalance you have, what kind of organs are overworking, less active. So we try to find out what kind of imbalance is there. So in order to adjust the imbalance, we stimulate those points to the balance you have. So
and the imbalance, you find all of that out through conversation.
Yeah, so conversation, yes, I think so. Patient's feedback, that's most important, because patient feels the change sometimes almost immediately. But of course, I need to check their pulse and tongue. That's more like an objective sign I can get from the patient. So patient's feedback, pulse and tongue, so that way I can see the progress.
Okay.
And there's actually been times when I haven't shared, maybe I forgot to tell them, and they'll say, oh.
Or you just didn't want to
Or
share.
He'll say, have you been stressing? Yes. So he can tell from the constitution of the tongue as well as the pulse. Like,
What is the concentration of the tongue?
The constitution, so like the color.
Yes. So we see the color of the tongue, like like color, coating, and shape. So that you tell acupuncture has many information. Yes.
Wow, that's amazing.
Yeah, it's very cool.
Can you explain how acupuncture can benefit women, either before pregnancy, during pregnancy? What are the real benefits?
So of course, like when patients come to clinic, of course they try to conceive, so they feel like lots of pressure, so stress, sometimes like depression too. So of course, actually doing acupuncture to minimize the stress and I think being calm, so that will help to actually conceive. So it's not just your body's like physical function, your emotional aspect is like, it's huge, as you can imagine. So I think patients gonna be beneficial doing acupuncture to like calm their mind, and so that's most important things.
So you think the stress impacts conception?
Yes. Actually, I found some like research how acupuncture can help to being pregnant, and like research said, even like without acupuncture, they check the stress marker with like each groups, and it's like, of course, less stress group has like more chance to get pregnant.
Right.
And of course, acupuncture can lower the stress. So of course, acupuncture can lower the stress. So that way, of course, increase the chance to pregnancy. Actually, there's a research for that. So during the pregnancy, of course, patient feels a lot of stress, and as I said, acupuncture is very safe during the pregnancy too. And I have many feedbacks from the mom who's getting acupuncture treatment during the pregnancy. They said their babies are so calm, and sometimes like doctors commented your babies are so calm, and even like after delivering the baby, like babies are very calm. These patients, they believe getting acupuncture treatment during the pregnancy actually not just helping themselves, but helping the baby to calm down. So yes, I think that's one of the benefits of doing acupuncture during pregnancy.
Wow. And that goes with things that we've said. The mother and baby are sharing the same space.
Right.
So obviously what mom is thinking and eating goes to baby and impacts baby.
Yes.
So that makes a lot of sense. Do you avoid any stomach area in acupuncture?
Yeah, so of course I say acupuncture is safe during the pregnancy, but we are not supposed to use some point. So of course we don't use any point in your stomach.
Yeah.
And some point in your body, it's very strong to move your energy and blood. So we are not supposed to use those kind of point. And so yes, as long as we avoid those points, again, acupuncture is pretty safe. So.
And do you find that there's different benefits in different periods? You had mentioned morning sickness. So do you find there's a common way that you support women when they're in their first trimester? Maybe there's different stresses in their second trimester or third?
Yes, I think most people come during the first trimester. That's the very common. Morning sickness is one of them. Sometimes even when patient has history of miscarriage, And of course, unfortunately, miscarriage tend to happen like a first trimester. So usually I recommend to continue acupuncture if they have history of miscarriage in order to prevent the miscarriage, because acupuncture can work for that.
Okay.
And after passing 12 weeks, maybe some different issue. Maybe I told you before, like diabetes, blood pressure, breech presentation, inducing the labor, back pain, still like anxiety, depression.
Right.
These are more common problems.
And what challenges do you see a lot of women and families experiencing after baby comes?
Yeah, after baby comes, of course, I mean, living in the Washington, D.C. area, I think...
That speaks for itself.
People feel a lot of stress, and I know babies are so important, so the mom thinks I can do anything possible for the baby, right? But they feel so much pressure, and maybe they don't get enough support from family. They can use their service, but sometimes they don't use that, so they carry all of the burden for themselves. I always tell patients, your energy, of course, affects your baby. So first you need to take care of yourself. No matter what kind of service you can get, or your family, take your time to take care of yourself. Of course, acupuncture is not just one of them, but doing acupuncture calm you down, and you will see that will affect how you can take care of the baby too. So that's the most important things.
Can I ask a question we didn't prepare you for?
No, that's okay.
In Japan, how is the woman taken care of postpartum? You mentioned, which is very true, and this is something we keep saying, in this area we don't support the new family. And obviously everyone is impacted. Yeah, of course, when I came here, first things I was surprised is after delivering the baby, the mom, they go back to work like almost immediately. So that's, to me, it's very surprising. And of course, in Japan, maybe like most Asian country too, after delivering the baby, as a mother, you did a lot of jobs. So it takes time to recover physically. And also, of course, you need to have connection with the baby. So most of the women in Japan, they take like a long break after delivering the baby, take care of themselves, spend time with the baby before going back to work. So I think that's the main difference. I think. How long do women generally stay home?
I say at least like 3 months, sometimes 6 months.
So can you tell us what advice you would give people if they're considering coming to Caring Acupuncture? You said there's a bunch of different services.
I think, of course, you can think about like each practice has like different like strengths, and some even like same acupuncture, some practice focus on more like pain management, more sports medicine. Of course, that's great. But of course, our focus, especially my focus, is more like women's health, like infertility. So I think maybe you can think something more again, getting pregnant, women's health. I think this place is a good place. And as I said, we offer massage, and one of the practitioners, she can do, we call like abdominal massage, like Maya abdominal massage.
I saw that.
So that's why she's here. And also, again, we do like V-steam. That's also good for women's health. So I think that's one of the focus. Of course, we can do so many things, but that's one of the focus of our clinic.
That's nice. It's important to have, obviously, your specialty. So
and some wraparound holistic services.
So Khyati, you said you've been going to Tetsuhiro for 15 years.
Yes, almost 15 years. And I started in my 20s.
Okay.
And I think I was actually going to the chiropractor in the office. And then I learned about acupuncture, and I hadn't known about it. I hadn't tried it before. And I had also been curious about holistic medicine, and there were things that were happening that were making me more skeptical of Western medicine and allopathy. And now I'll try anything that is natural and safe, because there's so much wisdom, there's so much anecdotal evidence. Even though a lot of things, like you mentioned, have research behind them now, they've been doing this for thousands of years. They're not going to keep doing something that's not effective. And so I started, I think it might have been for headaches when I first started. Stress, being in jobs that were demanding, or a lot of politics. And just over the years it evolved, so it could have been, my digestion hasn't been great. And so, like you mentioned early on, it was almost weekly. And now, as I mentioned, it's monthly, you know, and so our body kind of whispers to us before it yells if there's a problem. And so if you can start listening to the whispers, like if there's a pain here or something is off, you can sort of correct issues before they become bigger issues. And then of course when I conceived, when I was pregnant, he helped with a lot of those things, nausea, when my baby was in breech position. And then he also, do you remember you also told me about moxibustion?
Yes.
Do you want to talk a little bit about that?
Yeah, so moxibustion is also part of the Chinese medicine.
Yeah.
We burn like Chinese herbs and make some smoke, and this smoke apply some like point, and so we use for like breech presentation sometimes.
Yeah.
And so I think I gave you the mox.
You did, yeah.
stick, yes.
So I was doing the moxibustion
At
as
home.
well, at home.
Yes.
And
Because I'm going to get personal. You put it under your
no. It's,
That is
there's
the
a
point. Yes.
there's a pain point
There is
on
point,
your
yes.
heel.
Yes.
right?
Yes. On the toe. Yes.
Yeah. And then also the other thing that's been really great in combining with the acupuncture are the herbs that he's given me. And so there's one called Free and Easy. So if I'm really stressed out and I take some of those, I feel calmer.
Is it capsules or is it for
Or
tea?
these little pellets.
Yeah, there are
Yeah.
different types, but yes, it's pure. Yes.
Yeah, like little round ones. And then there's a great one that he's given me for sleep, especially in the later years after baby. You know, she's now a toddler.
Right.
If I can't sleep because of myself, whatever stress or, you know, active mind, I can take that. I know it's not habit forming. I'm not going to be addicted. I'm not going to wake up groggy, and I can still sleep. And so the herbs have been so great. And maybe you want to talk a little bit more about the herbs.
So like herbs, like same as acupuncture, we need to still like diagnose like each patient's different. So even like for the sleep, of course we have some few herbs, but it's not universal. It's not working for everybody. Still, like each patient like is different. So based on diagnose, we need to pick up like which formula is good for like each patient. So there are so many variety of the herbs and our formula. So I think again, asking question, checking the pulse and see time. So we will find out what's the cause of the insomnia instead of just like
The cause instead of the symptom.
symptom. Yes.
Which is how we work here
Right,
in Western world.
right.
Treating
Symptom.
symptoms.
Right.
Yeah.
So that's the good part of Chinese medicine.
And do they have herbs for kind of anything and everything?
Yeah, I think it's almost everything.
Wow.
And also, of course, when you're pregnant, sometimes people are afraid of taking the herbs. And some herbs, of course, we can't give some patient, but some herbs are pretty safe. And actually, some herbs are very important for prevention of miscarriage. Yes, morning sickness, again, safe for the pregnant woman. So not just acupuncture, we can do some herbal supplement too.
And one last question from me.
Yes.
How young do you do acupuncture? Like
So,
if there's a child.
yes. I think technically we can do even from the infant baby, but I think of course infant we can do like a needle. So we use some special tool to just stimulate, no needle, but to stimulate the acupuncture point. We do some like massage, some acupuncture point, maybe similar to like a.
Have you seen those little balls? They're very small that you can tape on the skin.
Yes. We call like C's, and so that's another. Like some
Or the
ear point, and so that's what we can do. Like real acupuncture, my youngest patient is 6 years old. So, but again, it's not about age. I remember, this 6 years old, he's fine with needle, but I remember like 12 years old, she cannot take it. Yeah, so it depends on
the
person. Yeah, it's not just age. Yes.
Okay. So going back to cultures, when we were talking about universal postpartum care, we were doing some research and found that in China and Japan, they now have luxury postpartum centers where women are paying.
It's like
women are paying $500 a day, and yes,
it's a lot, right?
And they're staying in these. They're almost hotels, but they have different rooms, and the room has a nice, comfortable bed, a crib, and obviously they're not with their other children or husband. They're really just the mother and new baby have time to rest, to bond, and there are women working there coming to take care of the mom.
That's great. That's
Yeah.
There's actually a center. So
in Annandale, there's a
Annandale is
center.
Korean.
Oh, really? Because of the
A Korean
Koreans,
center.
So, I think that indicates how important it is
Right.
for a mom to have time to recover, not be taking care of multiple kids or going back to work or cleaning and cooking. And for those who can afford it,
Right.
they can go to a hotel. And if you can't, at least there's still a culture around recovery.
Do you recommend to your patients, after having the baby, if possible, to rest a certain amount of time?
Yes.
Or
Yeah, I think that's ideal. If you can, again, just recovering your body takes time. Sometimes even you don't feel it, but you did such a good job to carrying the baby, delivering the baby. So I think it's better to take some break, hopefully like 3 months, maybe 6 months, to recover yourself physically, mentally, and again, make strong connection with baby. That's ideal. And if you can't, I think still it's better to ask some help to take care of the baby. You can spend your time for yourself. I remember I have one patient. She came after delivering the baby, but she has very hard time to find her time to come to get acupuncture. But she said, even she's coming, she says she feels very guilty. Just leaving the baby to the babysitter or mom, and so don't feel guilty. Yes, you need to take yourself. You deserve some time, and but that's the mindset. That's very typical. So I think I always tell patients again, don't feel bad. You can spend money, even like a luxury facility, but spend time to take care of yourself, and so that's the very important things. Yes. Mm-hmm.
What are some common foods or things that moms will eat to recover?
So you need to, of course, even delivery was successful, still you lost a lot of blood. So you need to nourish your blood from Chinese medicine, Asian culture. So I think some bone broth, I think that's good. Kidney is most important organ in Chinese medicine for carrying the baby, delivering the baby. So yes, actually after delivering the baby, not just losing the blood, actually the kidney function is going down. So from that aspect, maybe seaweed is good. I also recommend black beans, walnut. That's also good for the kidney function.
This has been so helpful and informative.
I know,
even after all
such
these
great
years of
information.
learning things.
Yes.
Can you summarize for our audience?
So first, acupuncture is not painful, so that's most important, and acupuncture is safe for the pregnant woman. That's another thing, and of course, acupuncture is stimulate your energy flow and blood flow, calm mind. So it's good for stress, depression, any kind of woman's issue, irregular menstrual cycle, infertility. And during the pregnancy, of course, acupuncture can be good for morning sickness, bleach presentation, again, depression, anxiety, back pain. And if even after delivering the baby, still patient has delivering the baby has a lot of change in your body. So that triggers some chemical change. So sometimes that causes again postpartum depression, and acupuncture can help. I didn't mention, but insufficient lactation, lactation problem, acupuncture can help. And so acupuncture can help to recover the mom's body after having delivered a baby. And so pre-conception, during the pregnancy, postpartum, and acupuncture can be helpful for any kind of stage of woman too. Yes.
Wow. It's really a lifestyle practice that becomes part of your life.
Yes.
That's awesome. I just learned so much. I had no idea about lactation. That's cool. Thank you so much for all of your wisdom and for sharing with us. If you are interested in learning more about caring acupuncture and Tetsuro Ueno, we will put his information down below. We would love for you to follow us on Facebook, Instagram. Comment below, let us know if you have had acupuncture and what your experience has been. And we'll see you next time. Oh, and as they say, ain't no hood like the motherhood. Bye. See you next time. Thank you so much.
Thank you.